Can I have bilateral, meaning both hands, carpal tunnel syndrome at the exact same time? I can't wait to share this case with you. Stay tuned. Hey guys, today I want to talk to you about a very interesting case that I've been managing for the past couple of weeks. When the gentleman came in to see me, he came in complaining of what he called bilateral carpal tunnel syndrome. For anybody that knows what carpal tunnel syndrome is that is when there is a compression of a nerve called your median nerve that runs through your wrist, through your hand, and affects basically these four fingers. Actually affects these three and half of this one here. And it's really common with people that do a lot of typing, that do a lot of serving, etc. So it's a compression over the carpal tunnel area. Now what's interesting to this case and why I wanted to make a video about it is, number one, this gentleman came in with bilateral carpal tunnel syndrome. Now, as a doctor, anytime something happens bilaterally, meaning it happening on both sides, it always somewhat piques our interest. Why? Because things don't happen usually to both sides at the same time. If it does, that typically means there's somewhat of a bigger problem or a bigger condition that's underlying. Let me back up and kind of talk to you about this case a little bit. This gentleman, who we'll call Steve, presented in the office a couple of weeks ago. Like I said, he came in with bilateral carpal tunnel syndrome, upper back, upper neck pain. Steve is a mail sorter. What he does all day long is sits forward posture, head down, and sorts mail. In addition to that, Steve revealed to me that he's somewhat of a video gamer, and he likes to go home at night and he plays about 2 or 3 hours of, I think it's Xbox or PS4, whatever it is, those online games. So as I started to talk to him a little bit about that, I had a lot of concerns. I had a lot of thoughts as far as what could be causing this. During our examination, during the different tests that we did, I started to do what they call a pinwheel test, where you basically take and run a pinwheel over different areas of your body, of your hand, and you're trying to detect if there's some sort of sensory deficiencies or certain areas that are more hypersensitive. And what I actually found with Steve is that the area that we're talking about, the carpal tunnel, the median nerve area, was not the areas that sent the red flags up or said, you know what, Bo, that's more sensitive, or, oh, I don't feel that. It was very sporadic all over. So it really got me thinking, what is going on with this person? Now I asked him why he thought he had bilateral carpal tunnel and what was his management plan for it. And he told me that he went to his medical doctor here just a few weeks ago, and they told him that there was pretty much nothing that they could do with it. They were going to refer him to a specialist, and most likely he was going to have his right hand operated on first for carpal tunnel syndrome, and then hope and wait that over the course of the next couple of weeks to months that it would hopefully go away. They thought that maybe with there being some congestion here, that was why this was being caused. So I sat back and I really started to think about this, and this is what I wanted to bring to your attention. If things are happening in both places, it's important that we think about tracing that back to where both of those places meet. And here's what I mean by that. I'm going to grab my spine here for a second. Now, as you guys probably know, this is a very big picture of a spine, but this is kind of a side, or what they call a lateral view of a person's neck. So this would be like your nose looking out this way. Now, each of these little guys, these bones, I'm going to bring it up, these guys are called vertebrae. And as you can see, there's some things that are sticking out the side here. These are obviously the nerves, as you can see here and here. These nerves feed different things throughout our body. They go to the muscles, they go to the organs, they go to the skin, etc. Right? Now, there's an area of the spine, it's between your 5th and your 6th cervical vertebrae. Those nerves go and they feed the areas of the hands. They feed the muscles of the hands, they feed the different sensory areas of the hands as well. So think about this for a second with me, guys. If a person has what we call forward head posture, meaning his head's supposed to be in good posture, but now it's forward. So his head's supposed to be sit like this, but now it's sitting like this. He has rounded shoulders, which means with his shoulders being rounded, the muscles in his upper part of his neck, these are called your scalene muscles, are now becoming very tight, right? And guess what? The nerves where these guys exit out of, they go underneath the scalenes, then they run down in front of the shoulder, and then they run down your arms and down to your hand. So this gentleman's in this constant forward leaning posture here, and he's completely cut everything off. Matter of fact, when he comes into the office, he almost looks like he's got like 3 or 4 chins because he's so rounded forward like this. So I said, you know what, Steve, let's do this. Let's work on a couple things. The very first thing that we need to do is we need to check these areas for subluxation or bone out of alignment, right? So we checked them and I was right. They were way out of alignment. See, 5, 6, I mean, they were super, super rotated. Matter of fact, when I pushed on it, he almost cringed because he felt like it hurt so bad. And I asked him, why do you think that hurts? And he said, you know, I'm not sure, but I do know that I look up and down probably 5,000 times a day as I'm sorting mail and putting it at different places. So the first thing that we did is we adjusted his neck. We needed to try to get that subluxation out of there and get the vertebrae moving. The second thing that we did is I gave him instructions on how to do self-massage with the scalenes, how to do different stretching exercises with the scalenes. And then the third thing we did is we worked on opening his chest up by working the subclavius muscle here, working on stretching and opening that whole chest cavity up and starting to breathe deeper. Well, I want to give you a little update. So I treated him. He came back 2 days later. He came back almost in tears, and he said, Dr. Bo, what did you do to me? And I was thinking, oh my gosh, what did I do to you? And he said, I feel 75% better. I slept through the first time for months, all the way through the night. The numbness and tingling in my hands are 50% better today. And I said, yeah, you know, I never thought that you had, you know, bilateral carpal tunnel syndrome. I always thought it traced back to the root cause, to the spinal cord via the nerves into the neck. And he said, there's really something to this. So he came in today. Now this is the third treatment in the last 2 weeks, and he said, Bo, I'm 90% better. I've been doing the stretches and exercises that you have told me every single day, and I cannot believe the difference. He, again, almost in tears, and I said, man, why are you so emotional about this? And he said, I got to tell you, I have 2 coworkers that have been through carpal tunnel syndrome. They've had the surgeries and they've been horrible. One of them had to retire. The other one's always on and off disability. It's literally ruined their lives. So as I sat here and I was finishing my day, I thought, you know what? I bet there's someone else that is watching this video that has had that same experience. Maybe you've had the numbness and tingling in your hands. Maybe you're looking and searching going, my goodness, is this really carpal tunnel syndrome? And you know what? It may be carpal tunnel syndrome, but I really encourage you to investigate all the way back, all the way up to the root cause and figure out, is it an organic issue here, or is it a systemic issue or organic issue that's going on in your neck? So if you're watching this video, the very first thing I would tell you to do is to go and find a local chiropractor, get checked by them, see if you have subluxation. Number 2, check your posture. Number 3, start stretching and opening up the chest, opening up all those different blockage areas in the body to see what feeds this down here. Remember, we need to find the source of the problem, not just treat the symptom. I hope you caught that. We always are looking for the source of the problem. We don't want to always just treat the numbness and tingling, the pain, the symptom. All right, guys, if you have questions about this, please send me, write a response below, ask a comment. I'll try to respond to everything you had. I'm super excited about this case. I think this was life-changing for Steve and for his family, and I hope that there's someone else out there that's watching this and can find some hope and some relief in this. Have an amazing day, guys. Talk to you later.